Slide stop गरिदिनुहोस् PowerPoint-मै ब्याकमा जानु पर्ने थियो म ब्याक जानु स्केप हालिदिन्छ अस्ति चाहिँ दिनुभयो म दिइसकेछु Good morning.
Good morning, sir.
Okay. How are you all?
Hi.
कस्तो छ तपाईहरु सबै आराम हुनुहुन्छ? Hello?
Yes, sir.
Yes, sir.
Okay.
Hello.
You say hello. Okay, good. So we'll start now the important topic for today. Especially it's very important as a medical person. पहिले चाहिँ डाक्टरलाई भगवान भन्थ्यो सबैले के डाक्टरले जे भन्यो त्यो ठीक no argument no information nothing else हैन कुनै पेशेन्टलाई यसो गर भनेपछि पेशेन्टले हुन्छ हजुर भन्थ्यो अब हामीले गर्थ्यौं हैन now it's not like that I think the patient must be equally informed they should be equally communicate about their disease and the reasoning, the evidences, you have to tell them everything, why you said you are suffering from this, and why you said you need this surgery or that conservative treatment or this medicine or that medicines. All things you have to tell them, okay? So the most important thing, if you don't do that, the person will not understand, the person will not know what you said, what you did, and what might be the complications or whatever it is. It is very important to make them aware of what is going on him and what we are doing. So if the communication is gap, then there is a lot of misunderstanding and a lot of mishaps are happening nowadays. कतिपय court caseहरू हुन्छ आजकल vandalism गरिरहेछ अघि हुन्छ there are a lot of things behind not necessarily they do they're genuinely also. So there are a lot of things that might prevent by just communicating them or making them one of the part of your treatment or one of your consultations, you know. So you have to make them one of the part of your diagnosis and treatment. So that is what is known as communications. And it has got a very, what you call a definitive pattern, and that pattern might be 1,000 types, you know. एउटा मान्छेले एउटा होला अर्को मान्छेले अर्को होला केटाकेटीहरुलाई अर्को होला नबोल्ने मान्छेको अर्को होला कम्युनिकेसन तरिका लाटो मान्छे कस्तो होला दिशाको मान्छे कसरी कम्युनिकेट गर्ने होला so communication might depends on the situations and the time and place and the condition okay सबभन्दा पहिले the first thing that you have to communicate with the patient is your history taking that I told you last time okay history taking is one of the very major part of a communications. Without communications, you can't take history, you can't collect or gather evidences to come to the diagnosis. That's why the communication is very important. So I told you about the history taking that if a patient doesn't tell you anything, if you can't get confidence of the patient and he or she doesn't tell anything, then you will not be able to diagnose the case. Okay, so that communication is very important. So that is one part. Okay, so this lecture has got two parts. One, communication is to gather the informations and share the informations and all the treatment part we have to do. So in general, when I talk about communications, you see, you have to have a competence in patient's care. Okay? So to be a competent medical officer, last time in my last slide, I told you what you should have to be a good doctor, a good practitioner. So definitely, it's like I told you, it's a tripod having 3 legs. One leg is knowledge, the other one is skill, then the third is attitude. Attitude means the way you behave, your personalism, your interpersonal and communication skill, and your expertise you have to experience, how to deal with, how can you change your attitude, how can you change your style, how can you change yourself according to the patient's, the type of patients, the nature of patients, nature of disease, the treatment part. So that is attitude. For that, you should have a good knowledge and skill. If you don't develop any three equally, might be just 80, 90%, 100%, something like that. But you develop your knowledge very good, but you are not in good skill, you can't stand. If you have good knowledge, good skill, but you don't, attitude is not good, your behavior is not good, the way you deal is not good, then you can't stand. So to be a good doctor, good practitioner, or a good professional, then you should have developed all these three at the leg of a tripod. What I said is known as what I call medical skill and attitude triad. What is known as, okay? So that's very important. So what is communication after all? You see, in Latin, it communes means communicate, meaning to impart, to share. It is so simple. You have to impart, or they have to impart. You have to share, they will share. So that's what two-way is communication. One way never becomes a communication. Okay, but there are a lot of different scenarios in this Latin word, that what communication exactly means. Those who can speak, they can speak out. They do not. Those who can't have dumb, they can't spell out. Those who are deaf, they may not be having the same communication skill as a normal person. Babies, laymen might be insane, unconscious patients. So this communication have a different faces. That just only speaking each other, right, giving in return each other, or communicating by your laptop or whatever it is not a communication. So a patient might be, dumb or insane, or might be what you call mentally retarded. They won't be able to communicate properly. So you have to take information or evidences from those patients even. That is also a communications. Okay, that's what you have to impart by telling or writing, or by your expressions, or you just by experience you can say that this patient is suffering from this by looking, by the look, that the presentation, all sort of things is important in communication. Not only speaking is communication. Okay. So there are a lot of definitions. If a medical knowledge, surgical skill, and clinical acumen is a craft of medical practice, then communication is a fine art. As I told you, that if you have good knowledge, good surgical skill or acumen, but you don't have a good communication skill, you can't work. So this is a fine art. But before I start my lecture, this very important topic, word, that is professionalism. We always say professionalism means a good dress, nice dress, branded clothes, okay, looking very smart, clean shape, this and black. That's not professionalism. Okay, having a coming by driving a very expensive car and this and that and good very office is not a professionalism. Okay, what is professional is an integral part of a good medical practice. Mind it, it's a good medical practice. What makes that good medical practice is which demands an effective communications. The medical practice means an effective communication skill along with knowledge, okay, and skill and competency and ethics. So that's professionalism. Okay, having a good word or know how to speak is not just professionalism. So you should have a good medical practice. For that, you should have a good medical, what you call, good knowledge, skill, competency, ethics, and very good communication skill. Okay, that makes it professionalism. Don't forget this term, professional, and don't use the professional term wherever you want when you see something about impressive. All impressive persons are not professional. Okay, that's very important. So the other definition that you can just get it in some of the books is it's a process where communicator sends his message through a specific channel to communicate and vice versa. Means the way they communicate each other might be different media, that is direct speaking, or might be by writing or email, or by signing. Okay, there's a by expressions. There are a lot of things, in communication, but there should be two-way communication, communicant, and vice versa. That's a two-way. The other one is the essential part of building and maintaining good physician. You see, patients, physicians, colleagues, core team or relationship help people to understand and learn from each other to develop the alternative perspective, meet each other need. So communication means it's not only the patient and doctor. It might be even patients with the physicians and your colleagues and other people. It's like lab people or X-ray people, or might be your even the administrative people. All they have to communicate to develop alternative perspective and meet and other need. Like you see, COVID, you have seen that it's not the doctors only can do anything. There are a lot of people involved, the administrations, the 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 the, the principal makers, the guidance, the people from other world, colleagues, they all sit together and they are coming with a conclusion what to do for the alternative perspective and to meet the need. That's communications. Not only doctor and patients, only they make a what we call the communications group. So Legan has said communication is a process by which two or more exchange ideas, mind it, is a two or more exchange idea, facts, feelings, or impression in the ways that gain common understanding to mean intent and use of message. Means, the goal is to cure the patient or do a treatment and cure the disease. Everybody's goal is that, whether doctor from Lahan or from Kathmandu or from Dhangadi, our work is to get a common to tackle a common problem, you see. So for that, if you put two heads together rather than single, it will be better, have a good result, and it gives a good message that we are doing together to come to a conclusion on a particular one objective or one problem. So see, this what is a teamwork. That is what the communication means. Single man might do a lot of mistakes, or might be there is a lot of what we call lacunae or weaknesses. Nobody will be perfect in this world. A good, if somebody says I'm 100% correct, anybody will say that I said he's a fool. Because that means he doesn't understand what medical line, what medical knowledge is. It's not enough. Many things that I know, you don't know, and many things you know, I don't know. Your standard, your status, and my might be different, but in some part you might be better than me. So if you can take help of yours, so I could get a good result and good input and good action to get cure the patient very well. So that's what the communication means. And communications, doctor and patients interact with each other in search of mutual understanding and share the solution to the problem. So what initially I said, that you have to involve the patient in your diagnosis and treatment part. So if the patient and doctor, they interact together and they will try to find the understanding in between them and to solve the problem. If the doctors doesn't cooperate, if the patient doesn't cooperate, you can't do a accurate treatment or can't come to a conclusion, and you can focus on the objective and tackle that objective. So when both of patient and doctors, they interact together, they discuss among themselves, interaction together, then they will come to the problem and you know how to solve that. Once you know the problem, that is the diagnosis, then any part of the world you go, you can treat the patient, no problem. So till then, you have to have all the facilities from the patient doctor. Doctor is not only doctor treating, there might be pathologists, radiologists, or colleagues, your seniors, or your monitors. So these are the doctors and not only patient parties, they are very close relatives, because many times patient doesn't know what is happening to him, but the patient party or the relatives might be knowing that. So all this, they put together, they sit together, they communicate, they interact, and come to a conclusion, and you treat that. That's what the communication means. Communication is simply the act of transferring information, you see, from the patient and from yourself. and interaction. Then you interact verbally or non-verbally. You see, now just mind it, verbally and non-verbally. That means the communication can be done verbally, definitely, but non-verbally also you can communicate between clinicians and patient in order to solve the problem. The patient came with a problem, okay? Otherwise, he won't come to you. He came with a problem which is disturbing his life. He won't be having good sleep, no food, always in mental pressure that he's suffering from some disease, but he doesn't know. So he comes to you and he will give some informations and you just acquire some informations and you interact each together and you come to a conclusion that what the patient is suffering from because of the patient. If you can speak, you tell you verbally. If you know he can't speak or he's deaf and dumb, you will have a non-verbal communications and you come to a conclusion. That's communications. So the Royal College has said the communication in medical practice is the process of information gathering and information giving. As I told you last time, when you take a history, the first part you are just having information gathering, okay, from history taking to investigation. You are gathering all the information by taking history or analyzing this complaint. Then you are examining that. So all the science you interpret and correlate with that symptoms. Then you ask for definitive or appropriate investigation. So you get some information from there and put all these three information and come to a conclusion. And you come to a diagnosis. Once you come to a diagnosis, then you tell the patients, okay, that this is your diagnosis, this is the this process, this is pathophysiology, this is how we have diagnosed, these are the point that you come to a conclusion, and you need to surgery or conservative, whatever it is. Then if you need a surgery, what surgery you need, what you have to do, then you take a informed consent, then you go for treatment, then you just what you call follow the patients, monitor the patients, and discharge. So this is all what is communication means in one section. Okay. Now, as I told you last time, this information gathering and information giving, history taking is sign eliciting and investigation, that is gathering information, counseling, informed consent, treatment, monitoring, discharge, and follow. That's a part of the information giving. So this all together makes a communication is specific task, that is to diagnose the case and treatment the case and cure the case. That's what. But there might be a quite a big dimension of the communications where you are supposed to be linked up one or other time. Not necessarily all the time you need to have all this, what you call the domain of communication. You have to communicate everybody all the time. But in time, in places or in a situation, you might communicate all these people. But the short arrow, you'll see, they are the one with the first line of communications, the circle of communications. Okay. First, doctor and patient, you are in the center. So if you can tackle all things, fine, good. Okay, that is very important. So if you can tackle them, but if you can't do that, and the most important part is that in the communications, patient itself is very important part, but the relatives are especially very important part of the communications. The first thing, if you think that you have done good, you are sure that his patient can diagnose you correct, then you are talking with the patient as well as the relatives. If you are not, then what you have to do is your teamwork, might be a unit or department, okay, you consult them, communicate them, and get what you call the informations and share the informations and come to conclusion, okay. And if you're not very sure, the teamwork is not well, then all of you, then other colleagues who are expert on that, where might be other department or other uh, seniors where you have to take help. Okay, and even sometimes you have to take the help from clinical or paraclinical or non-clinical people also to know that, like lab people, X-ray people, might be physiotherapists or or other people who are might be important for diagnosis. So if you're not then, probably you might have to take the help of hospital services. They are the one who can help you. If you want to send some patient for PET scan, it's not in your hospital somewhere, or might be better MRI, you have to send them. Okay? Or sometimes I'm surprised to tell you that even you people might be sometimes discussing with you people, undergraduate or postgraduate, might be very good, helpful to complete diagnosis. So everybody who are inside here are equally important. Your point. So that's why don't think that you are just a student and you don't know anything. But sometimes you know better than us, you are read better than us, so you can do that. So the first line of communications is what I always come to this point. All these people are being important to communicate them. And all you are doing this because of betterment of the patients and give a good diagnosis and good treatment. Okay? Now if during the process of treatment or your what you call uh, 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 services, there might be many times you have to communicate with what you call the medical university councils, okay? Because recently there is a circular coming from medical council. What they says, if you don't do any practical teaching, okay, practical lessons or practical uh, performance, will not recognize you. So now it's a problem. The university said us, you go for net teaching or by email teaching or by Zoom or whatever, you have to take the classes. But practically, it's not that easy to do that. Okay, because practical means you have to train your hand, your senses, all the six senses as you trained, but it's not that possible. That's why we're thinking how to do it. But council has said it. Okay, then there might be a lot of things that you need it in your hospital, treatment, is administration and management. You need a special instrument. You have to ask them for the treatment part. You have to communicate with them. Okay? Then, when you all do everything, then you need to do research work. Okay? Research work. You have to do a good job. You have studying it so good topics, and you have to research and publish it so that later other people know. That's also communication. Okay? A lot of things might happen to you. Okay, you see, is like policymakers. You need something, the policymaker has given you. Yeah, your promotions, your need, your further treatment, training, all these things. Or sometimes you might come across where your legal suit, you have to go to the court and you have to clarify things. Many things you have to do it. And sometimes, as you know that when there something happens, the media comes in and they are the one who flare up things, good or bad. So you have to communicate with them also. Okay. So this is what all the domain of the communication. On top of that, with all these things that you are having, you are communicating, you have got your private life and your family members, you see, your children, your wife, your mother, parents. You see, that's what, and you have to communicate them. You see, this domain of communications in medical line is not only patients and doctors or colleagues or paramedical service. There are a lot of things that involve in the communication. That's a very important part you should understand. Information giving, information gathering is not enough. That doesn't only enough in your lifetime when you deal with the patient. But this all it comes in your life when you deal with the patient. If everything goes right, well, that's fine. There will be no problem. But if there is something wrong, when knowingly, unknowingly, then you might have a problem. The legal sitting, the media will come to you, the administration management, there might be a lot of action query on you, and the policy might be